Do you find it challenging to get rid of your back pain and really work out the way you want without worrying about it, and you're really not making the progress you actually want? In this video, I'm going to show you exactly what you can do to fix this. What's going on, guys? This is Dr. Nick Bonforte. In today's video, we're going to be going all over low back pain. Now, a lot of times we have to really zoom out and think about what we're actually dealing with. Many times we get very focused on the intricacies of a pathological diagnosis. A disc herniation, sciatica, all of these things that are going potentially wrong with the spine. We get caught up in the weeds and we forget sometimes to take a bird's eye view of just looking at it on how we can actually address these things. So there could be mobility issues that lead to compensations at the back. For an example, if you lack ankle mobility and you squat and you don't have good ankle mobility, you'll tend to lean the chest forward. You repeat that over time, especially adding weight, can contribute to your low back issue. Possibility one. Two, if you don't have good hip strength or lower leg strength, it can lead to compensations, contribute to back. Or if your upper back doesn't move well, it can lead to compensations, contribute to the back issue. What the point I'm trying to make is there could be many reasons why you're actually experiencing it. And there could be a lot of non-specific low back pain. So in this video, we're going to be focusing on it from just a strength perspective, specifically working at it from the core. A lot of people just do a bunch of crunches, but we have to be considerate of other planes of motion and what the core is really designed for. So let's get into it. Now, when we're thinking about the core, there's three different planes of motion. The sagittal plane, which is the common crunches, the frontal plane, which is the common side bend stuff that we see, and then the rotational component, which is this plane of motion. So we're going to address the core in those three different planes of motion to really ultimately help the low back. So with this exercise, we're addressing the front core or the sagittal plane core. Or when you think commonly when we do crunches, that's the area we're trying to bias with this one. So we're setting up here with bands that are trying to pull me back like this. So I have to engage that front core to then stabilize against this resistance. So when I go to straighten my arms, I feel a lot of tension, really want to pull me back like this, and I have to really stabilize with the front core when I do this. Now, resistance is going to be very dependent on where your starting points are. The higher the resistance, obviously the harder it will be. But the idea is to be able to you don't need a lot of resistance to actually really feel your core engage with this. So you want to stay stiff in the core, you want to stay stiff in the glutes actually too, and then as you go all the way up, you want to pause, because this will be the highest level of effort here, and we're just going to hold this. You could hold this for isometric hold, or you can just go repping it out. The more you hold, the more time under tension you'll feel into the core. So again, you stay stiff, you go all the way up, you hold, you resist against the motion to go back like this, and you stabilize, really engaging the core and working on the sagittal plane motion. This is good because we're resisting motion, which is a lot of times what the core is designed for, to resist motion versus just producing it. Now, if you're an athlete, of course, you're gonna have to, like a rotational athlete, you're gonna have to be producing force. But a lot of times the missing component is just anti-motion stuff. We get caught up on a lot of movement stuff versus just stabilization type of work. So this is just a stabilizing factor here where we're going all the way up, resisting it into the sagittal plane for this exercise. Hey, real quick, if you're liking this content, I would really appreciate it if you hit that subscribe button. It really helps out with my channel and I really do appreciate it. All right, back to the content. Now with this exercise, we're working on a suitcase march. Now the idea with this is we're targeting the frontal plane or this plane of motion. By holding the weight is trying to pull me down into this position. So now I have to use the opposite side. If it's my left hand, I'm using the right side core to clamp down and stabilize against this. Now, if my hand is right by my hip, it won't be any effort, so I have to bring it out to the side a little bit to actually get that effect. So from here, I stabilize, and when I think about staying as vertical as possible, and then from here, I'm just doing a march. Now, the march adds a dynamic component to this, but when we're on one leg, it's more stabilizing factors to the core. So you want to think about getting stiff into the abs when you're doing this. So almost like act like someone's about to punch you in the stomach, you brace for that, you maintain that as you perform this actual marching effect, which is really biasing the lateral plane or the frontal core in this case, versus doing a lot of dynamic motion that we see a lot of this stuff for. Now, is that beneficial? Of course, but the idea with this video is to work on anti-motion stuff for more stabilizing factors to kind of bias the core in this anti-movement perspective that will help reduce pain levels and discomfort, because a lot of times this gets overlooked and we just move to a lot of dynamic stuff. Now with this exercise, we're working on anti-rotation for the core to help bias the rotational motion. Because now when I pull out in the band, it's trying to rotate me to the side of me because it's attached to the side. So the force with the band is this way. So I have to resist the rotation piece when I push out. So from here, it's starting right in front of my chest or in front of my sternum. I stay stiff in the core like someone's about to punch me. I maintain that, and then I push out and I hold. I could hold this position for an isometric, or I could just rep it out. The more I keep my arm straight out, the more of a challenge it would be. So from the side view, if I just go like this, there's not a lot of what's called a moment arm that will actually be resisted through here. Versus if my arm is straight out, the resistance from here to my spine is a lot longer, which put more force through this exercise, versus if it was just here. The force from here to here is a lot closer to my spine. So the more you go out with the arms, the harder it will be throughout this. So when I grab it and I push out, I barely feel anything here. I need to feel it right there where my arms are fully straight, and that will feel a lot of engagement into the rotation aspect. Again, going off the theme of this video, this is anti-movement. We're resisting against this versus actually producing force into a rotation, which is good for other phases. But again, this purpose is just anti-movement core work. So from here, stiffen up the abs, push out, hold, and then come back in, really stabilizing the core in the rotational aspect for this. I hope this video gave you some insight and perspective on things that you could actually do and start to implement currently to help you with your back issue. And if you did find value in this video, I would really appreciate it if you subscribe to my channel, like this video, turn on your post notifications so you never miss a video from me. Also, if you want to learn more about things that you can do to actually get rid of pain or make the progress you were really looking for, then click the link below to schedule your free discovery call with me or one of my team members. The call is completely free just to learn a little bit more about what's going on and what direction you might need to actually head in. If you're interested in that, again, click the link below, schedule the call, and hopefully I can hear from you soon. This is Dr. Nick. I'll see you next time.